There is a growing concern over the nationwide measles outbreak. The Centers for Disease Control now reports 101 confirmed cases in 10 states this year. Last month, a public health emergency was declared in Washington state, where there are 55 confirmed cases of the highly contagious viral disease. The CDC says the majority of the patients were not vaccinated. Meanwhile, the World Health Organization has named vaccine hesitancy as one of the top health threats of 2019.
And since most of the children who have the measles were not vaccinated, we wanted to find out how local health officials are responding. Sunrise reporter Chelsea Torres is live over at the Nueces County Health Department. So, Chelsea, what are experts saying here?
Well, we did speak to two doctors who actually fear this anti-vaccine movement. Meanwhile, there is one local doctor who believes that you should question everything that you're putting into your body. The anti-vaccine movement has been around since the 1850s, but the CDC says vaccines prevent 2 to 3 million deaths worldwide a year.
The reason that we have such a healthy nation is because people got their vaccines.
Dr. William Bergen of the Corpus Christi Health Department is concerned with the most recent measles outbreak.
Not only are people not getting protected, but the result of not being protected is being manifested.
This is a tragic situation. Now, here in Corpus Christi, we are much better off. I mean, there are not that many people who do not vaccinate, but unfortunately, tragically, that number is going up.
Dr. Jaime Fergie, infectious disease doctor at Driscoll Children's Hospital, agrees that everyone should be vaccinated to protect themselves and the community.
There are children, for example, who are too young to receive a vaccine, and they depend on the community being well protected so that the child doesn't get the illness before the age at which he or she can get the vaccine.
Recent reports show that the measles outbreak has sparked because of vaccine hesitancy. Local Dr. John Sullivan says people should question some vaccines.
A lot of parents are starting to question some of the efficacy of using them, so they hesitate. And with any medication, you should, because all medications have potential downsides.
Dr. Sullivan also believes that vaccines should be looked at on an individual basis.
Too often we're doing this herd immunity thing, and we're not cows per se. So I think you need to sit down with your physician and have an open, informed discussion and be an informed consumer.
The CDC recommends everyone stay up to date on all vaccines throughout their lifetime. Now, since the big measles outbreak broke in Washington state, they've actually seen a 500% increase in the use of the MMR vaccine. You can find more information on our website, christv.com.